I'm Tom Shalhoub, and this is the Fox News Rundown.
Friday, March 1st, 2019. I'm Lisa Brady. Some of the world's biggest drug companies get a Capitol Hill grilling over drug prices. But will the talk translate into any action?
Well, the healthcare lobby, for example, is larger in Washington than defense, tobacco, and guns combined. And so money talks.
I'm Chris Foster. Stop, look, and listen to one of America's favorite crossing guards.
I wasn't trained or anything. They just gave me a uniform and put me on a corner. And I've been on corners ever since.
And I'm Chris Wallace. I've got the final word on the Fox News Rundown.
It's a showdown that skeptics might say was really just for show.
It is long past time to drop the excuses and take concrete action to make medicine in America more affordable.
That's Oregon Senator Ron Wyden, ranking Democrat on the Senate Finance Committee, at a Tuesday hearing with executives from 7 pharmaceutical giants in the hot seat over drug prices in the U.S., often much higher than the price of the same drugs in other countries. Iowa Republican Chuck Grassley chairs the committee.
I've heard from people about skipping doses of their prescription drugs to make them last until the next paycheck.
Fox Business Network's Hillary Vaughn followed the hearing.
Several of the executives defend their high prices here at home, saying they need the cash from profits to fund research and development and invent breakthrough medications. But senators push back, saying the companies benefit from tax breaks, billions of dollars in grants and other subsidies to develop new drugs funded by U.S. taxpayers who then can't afford the drugs they help subsidize.
The companies also argue the kind of astronomical price increases that make headlines are anomalies. But all 7 at the hearing, including Pfizer, Merck, and AstraZeneca, say in general they agree prices are too high and they would support changes to the system. They also singled out rebates to middlemen, urging Congress to get rid of them.
The companies say the middleman that negotiates supply between drug makers and pharmacies are keeping all the savings that could be passed down to patients. So Congress has a proposal that would eliminate rebates. But first, they want an on-the-record promise from all 7 companies that if they do get rid of rebates, they will, in fact, lower prices.
Bottom line, the ball is in Washington's court.
Well, the real challenge that we have with drug prices in the U.S. is the fact that it's really a lot of the regulatory structure on how we bring drugs to market and the costs and time frame to do it.
Seth Denson is a healthcare market analyst, president of GDP Advisors.
The U.S. government and how it regulates both the patent laws as well as how drug manufacturers, the testing and everything that has to go into it, it's extremely inefficient. And it requires, on average, about 12 years and up to $2 billion to bring a new drug to market. So this is really what's driving the overall cost in the U.S., not to mention all of the ancillary hands in the cookie jar, so to speak, that everybody's involved in when it comes to actual pricing and distribution of the drugs.
Some of what we hear from the companies, like at this Senate hearing, is, the billions of dollars that they're spending on research and development. And obviously, you want a lot to go into research, right? And you also want regulators to take their time approving new drugs.
No question, you want to make sure that any drug you're taking is safe. But in the U.S., we don't allow foreign testing in other markets into the U.S. So the FDA, before approving any drug, won't even allow testing in, let's say, Great Britain or France into the U.S. And so a drug manufacturer has to start from ground zero in order to take it through the proper channels and testing before it can get approved to trials and then ultimately to the marketplace.
There were some lawmakers at the hearing who basically, in so many words, accused some of the big drug companies of price gouging Americans.
I think that you charge more here because you can. And American taxpayers are subsidizing all of you.
Michigan's Debbie Stabenow made the point that, they don't charge the same in Europe, for instance, or in Canada as what they're charging here.
Well, they don't, but they can't, because what's happening is in these other foreign markets, they have government-controlled health care. And so the foreign market governments have set price controls. And so what happens is the U.S. taxpayer ultimately pays back the pharmaceutical company for all that research development. So the U.S. taxpayer is paying for bottom line growth, while in the foreign markets, It's just top-line growth because they have to get all of their return back from the U.S. citizen.
I guess the bottom line is that there really is no simple across-the-board way to make things a lot cheaper without the companies losing a lot of money.
Well, there's not. But listen, if the government was really serious about doing something about the pricing of prescription drugs, they would allow the free market and competition to work more effectively. Things like allowing foreign testing into the U.S., allowing foreign manufacturers to sell drugs in the U.S., as close as Canada, for example. All of these things would drive down costs. And in addition to that, you have the U.S. Patent Office, which readily allows for drug manufacturers to not only get new patents, but then extend those patents for years on end. OxyContin, for example, has been on patent since 1996, I believe, and it's still on patent. There cannot be a competitor because what happens is the drug manufacturers have gotten really smart about making slight molecular changes to these drugs, and by doing so, the Patent Office will extend their patent for a number of years beyond the original patent, and then they get to squash out the market.
Another thing that I heard from at least one of the drug company executives, Jennifer Taubert, who's one of the vice presidents with Johnson & Johnson's Janssen unit, and she was making the point, or at least trying to make the point, that insurance issues bear some of the blame for the rising costs.
While our overall price decreased for the past 2 years, patients have seen their out-of-pocket costs go up. One reason is increased enrollment in health plans that require patients to pay more for their prescriptions.
There's no question that the insurance companies are culpable in all of this. You've got to understand that in the U.S., the drug manufacturers don't sell those drugs directly to the end consumer. They flow through what are called PBMs, or pharmacy benefit managers. Roughly 80% of all drugs in the U.S. are distributed by one of 3 PBMs. All 3 are owned by insurance companies. And so the unintended consequence of the Affordable Care Act was that insurance companies needed new revenue streams to make sure they were in compliance with the ACA but still hitting their profit margins. So they bought up the distribution market because all of that is profit that they get to effectively put on the backs of the premium payers, the U.S. citizens, but get to report it as unintended income for purposes of the ACA compliance.
Some of the lawmakers at the hearing made the point, too, this is also a big issue for taxpayers because the U.S. government, for various government programs, purchases a significant amount of prescription drugs.
That's right. The U.S. government is actually the largest procurer of drugs in our country through the Medicare and Medicaid system. And through Medicare Part D, for example, it uses the private pay system. It's extremely inefficient. So the challenge that we have is the way that the lawmakers have structured how they buy drugs. It's all based on percentages. So in Medicare, for example, the drug manufacturer has to sell it at a percentage discount of market rate. I say this all the time. Percentages don't matter. Prices do. I'll give you a percentage discount up to 99% if I get to set the starting rate. So the whole methodology by which they buy drugs, it's just convoluted and doesn't make sense.
Is this one of those issues that they raise it, they say this is really important, they have a hearing on it, but then nothing really changes and that's the pattern that's going to continue? Or is this a case of these pharmaceutical companies feel like maybe something is going to change and maybe they need to go and sort of stake a claim and say, oh, no, here's proposals that we've done on our own to try to improve things so that you, Congress, don't come in and try to make changes, mandate changes?
Well, the real issue at large here, and this isn't talked about much, is the fact that the Senate committee that oversaw these hearings has received over $2 million in PAC monies from the pharmaceutical industry. So I question those asking the questions and what their real ulterior motives are. If the U.S. government wants to get serious about driving down the cost of drugs, it's not calling out the pharmaceutical industry, which I'm not quick to defend, but the pharmaceutical industry is playing by the rules set forth by the U.S. government. If the government wants to change the cost and drive costs down, they need to change the rules.
It sounds like you're not necessarily optimistic about that happening.
Unfortunately, I'm not, just because history tends to repeat itself. And until we do something that restructures the lobby, for example, the healthcare lobby, for example, is larger in Washington than defense, tobacco, and guns combined. And so money talks. And at the end of the day, I'm not really confident we're going to see much change.
Healthcare market analyst Seth Denson, thanks so much for your time.
Thank you.